This tutorial will explain the patient pharmacy label, how to set your printer margins for printing, and how to properly place the label on a medication bottle or package. The pharmacy label contains all of the patient-specific details compiled during a dispensing transaction and is only available after you've completed a transaction. It is the first button option found in the Printing Options section on the Dispense checkout screen. When you click the button to print, a pop-up will appear which will allow you to select the printer the labels will be printed from. To ensure the label prints properly, you will need to set the printing margins in your internet browser. If you are using Google Chrome, you'll want the margins to be set to minimum and to make sure that the headers and footer checkbox is unchecked. If you are using Firefox, in the Format and Options tab, make sure the Shrink to Fit Page Width option is unchecked. And in the Margins and Header/Footer tab, set all margins to 0.25 and make sure all of the drop-down fields in the Headers and Footers section are set to blank. All printers are slightly different, so if the label still doesn't print correctly, contact your vendor representative for further assistance. Pharmacy labels require a special label sheet, which is usually supplied by your vendor. The labels are an 8.5 by 11 sheet of paper with various stickers and perforated sections that the label information is generated on. The most important sticker is the one located in the top right corner of the label. This is the patient-specific medication sticker, which is placed on the medication bottle to be dispensed. Most repackaged medication labels include the primary med label, which contains all of the medication specifics, and 3 to 4 peel-off tabs that are used in patient logs, on HCFA forms, in billing sheets, and so on. Those tabs are generally removed before you apply the printed label. When placing the label on the bottle, be sure not to cover up any existing label information. Many packages, such as powder suspensions, contain specific instructions on how to mix the medication and should be kept visible. So look for an area on the package to place the label that won't obstruct these details. With the tabs on the bottle removed, you should have enough blank area around the back of the bottle to affix the pharmacy label. Start at the existing label's edge and wrap the label around the bottle. The 6 yellow stickers in the middle of the label sheet are warning and side effect labels that can be placed on the bottle if there's room, or placed along the bottom of the monograph down below. The monograph section includes all of the FDA warnings and instructions specific to the medication. It is a perforated tear-off sheet that is placed in the pharmacy bag along with the medication and given to the patient. The patient receipt sticker is optional but can be used in many different ways. Some practices use it to record the transaction in a separate logbook or in the patient's physical chart. Others use it as a sticker to seal the pharmacy bag the meds are placed in, which the physician can then visually verify before the final handoff to the patient. In the middle section of the label sheet, the first 2 stickers are optional. The first is an informational tab which contains the details of the dispense. The second is a barcode that contains the patient's details. If you do not use these labels, they can simply be shredded. The third sticker is used in manual logbooks to record the patient's signature as proof of receipt of the medication and confirmation that they understand how to properly take their medication. If the patient requires additional counseling, the prescribing physician should have a one-on-one conversation with the patient to answer any questions they may have about the proper care regimen. If you have any questions about the pharmacy label or require help to set up your printing margins, contact the support team at First Coast Health Solutions, and we will be happy to assist you. Thank you for watching this tutorial. Additional support videos are also available on our YouTube channel.